Hi, my name's Dr. Rob Szabo, founder of the Low Carb Clinic. Like me, you're probably getting many emails from businesses you either knowingly or unknowingly were connected to in some way. I've chosen to send this message based on the many inquiries and conversations I've had with patients so far during this period of unprecedented public health uncertainty. I hope it's helpful for any of you who are or have previously explored a low carb lifestyle for better health. While I'm fortunate to no longer be classified as having type 2 diabetes, I've never forgotten how vulnerable and confused I felt, even as a doctor, when I was diagnosed 8 years ago. It was my experiences that led me to start our practice to medically guide others who struggle with a host of insulin-related conditions like diabetes or being overweight to ultimately achieve the same results I did. When we recently announced that we were switching entirely to a remote model, it was primarily with the goal of being able to reach more people, to let them know that reversibility was not only possible, but in many cases very likely. I wish I could say that we were being proactive about adapting to the current crisis, but I have to admit its severity wasn't really on my radar. However, it's not lost on me that among those that are most susceptible to the virus are those like the patients we've seen over the last 5 years. Now more than ever, we're committed to help people reduce the risks associated with insulin-induced conditions that can compromise our health. I know the anxiety that many of us feel, whether for ourselves or our loved ones with compromised health. The sense of lack of control can be overwhelming, but every day each of us can be empowered to make decisions and choices entirely within our control. And I'm not referring to just washing our hands or social distancing, even though those remain the most effective measures to reduce the likelihood of contracting the virus. Whether cloistered at home or striving to continue with normal life as best as possible, I want to encourage you to continue on the journey you've started or are considering to start, whether you last saw us yesterday or years ago. Do what's in your control to increase the likelihood of reversing the health condition that may be affecting you. On a practical level, number one, stay active. Even with gyms closed, this is not as hard as you might think. There's plenty that you can do either at home or in open public places away from others, e.g. in a park. Not only is this important physically, but it helps to maintain a healthy state of mind. Number two, food-wise, we've heard from some of you that being home more, it's easier to eat carbs, especially if, like the rest of the world, you felt obligated to stock up on items like rice and pasta. It's also easier to snack throughout the day if you're not at work, given the easier access to food in the refrigerator. Plus, snacking can feel good and momentarily eases our anxieties. The stress of a confined home environment, even with loved ones, can quite easily lead to detrimental alcohol consumption. However, we have more options and therefore control than we may initially realise. For example, while supermarkets are struggling to remain stocked, consider alternative sources of food, such as the butcher's shop or greengrocers or direct from farm online retailers. Some of these options have more produce and may be willing to sell in bulk. Most are also taking orders by phone and happy to either deliver or arrange a quick pickup, allowing minimal contact with others. Not only that, you'd be supporting local businesses at a time when they need it most. If you want to stock up, consider purchasing long life variations of goods like milk, frozen veggies, canned fish and cheese. Take advantage of the abundance of easy recipes with simple ingredients like omelettes or stir fries. If you like veggies, now may be an excellent time to start a veggie garden. Even if you're not rural, you can pretend you're on a farm. If you haven't yet tried it, you can jumpstart your results by finally starting intermittent fasting. And finally, if you made the mistake of stocking up on extra carb-packed foods like pasta and rice, nothing beats the feeling you'll get if you donate them to a food bank. I hope this list prompts other ideas you may not have previously thought of. Before I go, allow me to address two topics that have come up recently in my consultations. With the uncertainty we face, especially financially, it's wise for all of us to save money where we can. Here are my thoughts on our fees during this time. First, we hope the new subscription model we implemented this month makes it more affordable for you to access us continuously. Second, I know firsthand the impact of a low-carb lifestyle on reversing conditions like diabetes and reducing the risk you might have with chronic disease-related hospitalisations. As we work alongside you, we hope this can be seen as a worthy investment in your long-term health. In fact, if you consider our fees to be just a splurge, I encourage you not to spend the money with us, but save it or invest it elsewhere. Third, Medicare has recently announced temporary financial incentives for patients who see medical practitioners remotely. It's not yet clear if they apply to us, but we're working hard to see if we can ultimately use them to make access to our subscription services even more affordable. Some of you have also raised concern about not wanting to be exposed further by going through with the pathology process or taking up pathology resources. The reason we ask our patients to go through this process in the first place, typically without any out-of-pocket expense, is because the blood results provide the best objective measure of progress. For example, it's the best and most cost-effective way of knowing if one's HbA1c is no longer diabetic or pre-diabetic. Further, the pathology centres like Melbourne Pathology have communicated that anyone who is suspected of having COVID-19 will not be seen in their collection sites and will be referred elsewhere. As such, we're not overutilising the pathology resources and we're no more at risk of acquiring the virus in a pathology centre as we are of obtaining it at a cashier in a supermarket. Thank you very much for your time. As always, if we can be of any support, please do not hesitate to get in touch. The very best of health to you and your loved ones.